I hope everybody's doing well. I'll give this a few minutes for people to arrive. Seems like the sound is pretty yep. So we should be good to go here. I think I'm just testing out my new microphone. Everything looks like it's going pretty well. So, hello to the two people who have come in so far. We'll wait for people to gather. Sorry, I got a slightly late start. I actually left the bones that I was going to use downstairs. So here we go. I've got my bag of bones right here. That's a very weird statement. If you can't hear me too well because I'm trying out a new microphone, and as you can hear, my voice is mostly back, but not quite there. Just let me know in the chat box on the side, and as long as you can hear me, then we can probably get some stuff done. So let me just get myself organized here. I'm gonna lay out some bones here. We have a sacrum, of course. We have a whole bag of vertebrae. Okay, so some of you are probably wondering what's about to happen here. So this is a chance for us to review everything that's related to this particular lab practical. The first section of the skeletal system is going to deal with the skull, the vertebrae, and the sternum. So most of what we call the axial skeleton, which is sort of everything down the middle of the body. So as I sip on my throat coat tea here, it's very, very good. I highly recommend it. And I am using our Dog Mom mug. Excuse me. We have our new microphone here. Say hello to my little friend. And hopefully that will help with the sound, smooth that out a little bit. I know it does a really good job of kind of eliminating all the background sound. So it's pretty quiet up here in my office, but I think this will do us some good. So there are 8 of you here, and I think that's a pretty good number. So I'm going to spend some time. I've gone ahead and printed off a copy of the study guide. So I think I'll probably start by just going through each bone one by one. We'll start by going over the entire skull. Then we'll spend some time with the vertebrae and with the sternum. Sternum should take all of about 30 seconds. So to start, I think it's useful to remind you of the format. The format for the lab practical, which will happen tomorrow and Tuesday, will be 20 stations, all spread out around the room. It's going to go clockwise from the left-hand side of the room as you're looking toward the back. And there will be a minute and a half at each station, and then about 5 minutes at the end. And I'll be a little forgiving there, where you can go back and look at any station that you might need. I found historically that this was more than enough time. We've had one person take the lab practical so far because she's going to be here. She's going to be gone this week. She took about 20 minutes. So that some of you will be a little frustrated that you have so much time because you'll be able to get it done much quicker. Others, you'll be right up against that time. my recommendation is to put in the work tonight and tomorrow to really get this stuff down. If you know it, you're not going to hesitate. You're not going to second guess yourself. And that's where you're going to lose time. Where there is a time limit here, you want to commit. You don't want to spend a lot of time second guessing yourself. And if you put in the work, if you're confident in your preparation, there shouldn't be any hesitation, because this stuff is kind of either you know it or you don't. Your note card can help, but only so much. My recommendation would be to use that as sort of a word bank. The bones that are tougher for you to remember should go on there. Certainly the parts of each bone can go on there, organized by bone. I purposely made this study guide the way I did because I wanted to organize it by bone. So you should have a lot of that work done for you, and it's just a question of what you really need to include on your note card. Remember, the rules are one side of a 3x5 index card, no pictures. If you don't have that, I'm going to have to make you change it. I'll try to check it at the beginning of class so you have time to put something down if you need to, or to pare it down or whatever. But we'll cross that bridge when we come to it. So in the meantime, let's go ahead and start running through the bones. I think that'll be a good use of our time. So another sip of tea, because I can already tell this is going to be a bit of a skull, so bear with me here. Let's start with the skull. The first bone on your list was the frontal bone. Now, the frontal bone is really, really simple. It is right here on the front. I can't imagine anybody missing that. The one thing that may be difficult, and I'll try to get close enough here to show you, is the supraorbital foramina. They are right here. So supra is from the root of superior, meaning above, and orbital refers to the orbit, the eye socket. That is a region which I will expect you to know. There are, I believe, 8 bones that technically make up part of the orbit. So it would be a very good idea to look at that eye socket and to try to identify the bones around that eye socket. But in the meantime, the supraorbital foramina are the only parts you really need to know on the frontal bone, and you can see that opening right there. So that's the frontal bone. Super easy. Then the next one on the list are the parietal bones. You can see the parietal bones right up here on the top of the skull. If you're looking at it from the side, you can see the squamosal suture right here, which separates the temporal from the parietal bones. And so the temporal bone is down here. The parietal bone is up here. That was probably the most commonly missed item on the quiz that we had, because a lot of you didn't think about the fact that the parietal bone is higher up. And so you identified this as the temporal bone. It is a little harder to see from the front, but the beauty of the lab practical is that you'll be able to turn the skull however you need to. And odds are the thing that you need to see is going to be right in front of you. So there's not going to be a lot of guesswork there. So the parietal bones are pretty simple. This would be a good time to talk about 2 of the sutures in addition to the one we just talked about. So this is the coronal suture that separates the frontal bone here from the parietal bones behind it. Speaking of the parietal bones, if I get a little closer here, you can see the sagittal suture, which separates the 2 parietal bones. And you can see them on either side here. Of course, we have the squamosal suture on the side, this curved suture right here. And of course, on the back, let me make sure I get the angle right, we have the lambdoidal suture, which separates the parietal bones above. Let me get my finger out of the way. The parietal bones above from the occipital bones below. So, of course, let's move on to the occipital bone. The occipital bone forms the back of the skull right here, and also most of the underside. So all the way to about right here about right here, I would say, is part of the occipital bone. Now, there are several parts that you need to know for the occipital bone. First is the external occipital protuberance. You can actually feel this on the back of your own head. There's a pointy part on the back of your head. That's the external occipital protuberance. It sticks out right here. You can see this little point right here. If you look at it from the side, you can also see it sticking out right here. Then, of course, we have the Foramen Magnum. That is really the only opening that I will expect you to be able to identify which bone it's a part of, because it's super obvious. The two bumps on either side here, which you can see a little better in 3 dimensions here, are the Occipital Condyles. And odds are the opening that is between the Occipital Condyles is going to be the Foramen Magnum, and it's going to be part of the occipital bone. So, again, I think that if you need to identify this bone, it's going to be fairly obvious where it belongs. I would also expect you to know where these occipital condyles are and the name of the opening between. Okay, quick sip of tea. And as always, I see that the live chat area is blank. If you have a question, if you're not seeing anything correctly, if there's something that comes up as you're going through this, I'm going to try to get through everything. But if there's something that I'm missing, please feel free to chime in and ask me a question. Okay, so now let's move on to the temporal bone. There's a lot to see in the temporal bone. So the temporal bone is going to be along the side of the skull. So all of this right here is going to be the temporal bone. It does also go underneath a little bit, but odds are if I ask you to identify it, it'll be from the side. So the obvious opening here is the external auditory meatus. That is the ear hole. That would be associated with the sense of hearing. The structures of the inner ear originate right here. You'll also need to know several processes in the temporal bone. You can see this one right here is the mastoid process. That's a rounded process that actually you can feel right behind your ear. We've talked about that a number of times. Then we have the styloid process here. I think that's probably the best angle. And it sits right behind the mandible. You would have to kind of look behind the mandible to see it. You can see that it's very pointy. It's one of the more obvious processes that you see in the skull. So the mastoid process is the rounded one up here, and the styloid process is right here. You also should know the mandibular fossa. The mandibular fossa is the spot on the temporal bone where the mandible fits in. So it's basically, if I were to remove the jaw, which apparently I just did, that wasn't supposed to happen. I should make a blooper reel for this thing. The mandibular fossa is going to be this depression right in here. It's covered with a ring of cartilage here, which is actually how it appears in the body as well. So I guess I'll just keep this mandible off for now. We can come back to that later. So the only other parts you need to know for the temporal bone are going to be this is a little weird and a little frustrating, frankly. If you look very closely here, what we're looking at here is the zygomatic arch, this whole length of bone right here. Now, this is what we know as the cheekbone. And you can see here a tiny little suture that I'm kind of tracing with my finger right now. Now, everything to the right of this on my diagrams on the screen. So everything sort of toward this way, toward the front of the skull, is part of the zygomatic bone. This part that sticks out is called the temporal process of the zygomatic bone. I know, it's frustrating. But then this part right here, this thinner part that sticks out toward the zygomatic bone, that is called the zygomatic process. And collectively, those two structures make up what we know as the zygomatic arch, which is sort of the fancy clinical name for the cheekbone. All right, so now that my throat is coated again, I've only got water to tide me over the rest of the way, so we'll see how this goes. But okay, so I think that is pretty much it for the temporal bone. You can see that there's quite a lot to it, but while we're at it, we may as well go to the zygomatic bone. The zygomatic bone obviously forms the sort of side of the orbit here along this side, and really the only structure that you would need to know would be the temporal process here, which forms part of the zygomatic arch. So if you're asked about the zygomatic arch, you would need to know that the temporal and zygomatic bones sort of connect to form that zygomatic arch. There are a lot of muscles that attach here. There are a lot of other structures that go through this gap. It's a surprisingly complex part of the skull. So now we're on to the sphenoid. This is where things get a little interesting. The sphenoid can be found in a lot of different places. On the outside of the skull, you can find it right there. You can also find it at the back of the orbit here. So back there is the sphenoid bone as well. Like I said in class several times, the place where I'm likely going to ask you to identify it is here. You can see along this ridge right here that there's sort of a bat-shaped outline there with a few sutures in between. You notice that there are sutures everywhere. We could name all of these sutures if we wanted to. We're going to stick to the four major ones that we've discussed in class. But this is a suture like any other, and it actually helps you see the outline of the sphenoid bone. We've described that as like a bat shape or a butterfly shape. Some of you wanted to describe it as a moth because it looked ugly. Frankly, I think moths are beautiful, so you call it what you want, whatever gets you there. Now, aside from the openings, which we're going to treat separately later, the big thing that you're going to need to identify here is right in here. So I'm sticking my finger in this opening here. It's a little, so you can see it from that angle. I'm actually able to stick my finger in that depression. That is the sella turcica, Sellaturcica. Latin is weird sometimes. And that is from the Latin for Turkish saddle. Apparently that's what saddles used to look like in Turkey. And that is the place where the pituitary gland sits as it hangs off the base of the brain. So it's a really, really important spot because the pituitary gland pretty much runs the show in the endocrine system. We're going to learn about that a lot later in the year. So, next we have the ethmoid bone. Now, the ethmoid bone is going to be identified from the inside here. So you can see a part, if I sort of angle it here, you can see that this part sticks up out of the skull, and this part is called the crista galli. And then there's a flat portion around it with a bunch of little holes, and that part is called the Cribriform Plate. Now, the openings in the Cribriform Plate are called olfactory foramina. Olfactory refers to the sense of smell, and foramina obviously are openings. So these are actually literal smell holes. Smells come up through your nose, and they come up through this opening And right up here above the ethmoid bone are olfactory bulbs, special nerves that process smells. So it's a really important spot in the nervous system, actually. Now, the only other place where I might ask you to identify the ethmoid bone are here in the nasal septum. So the nasal septum is the boundary between the two sides of the nasal cavity. So you see right in the middle, you see this flat part right here. This flat part is called the perpendicular plate of the ethmoid bone because it's perpendicular to most of the other bone. Then, as it sort of broadens out at the bottom, you can see the vomer bone. The vomer bone is where it gets a little wider right here at the base, and it actually goes all the way back. But those are two things that you would probably need to identify from the front. So the ethmoid is here, the perpendicular plate of the ethmoid at least, and then the vomer bone is down at the base here. You want to make sure that you don't confuse the nasal septum, which is here, with the nasal bone. So you can see the nasal bones right here at the top. Two very thin bones that form just the bridge of the nose. So they're very, very small. So those are the nasal bones. This is the nasal septum right here, made up of the ethmoid and the vomer, like we said. I haven't heard anything, so I'm assuming that my voice is sounding all right, that you can hear me just fine, or that you're happy with me just making random gestures and pointing to things. So let me grab a sip of water. Let me spill water on my love seat, apparently. It's just one of those days. Okay, so now let's talk about the jaw, shall we? So the upper jaw here, obviously we've removed the lower jaw, but the upper jaw is made up of the mandible. And you can see here, actually, there's a really good view right here of the one real part that you need to know in the mandible, and that is the infraorbital foramen. That's right where my finger is pointing right here. Infra comes from the root for inferior, and again, orbital refers to the orbit or eye socket. So this is the infraorbital foramen. The one real part you need to know in the maxilla. I actually love this view right here where you can see through nice and bright. So then the only other part you will need to know about the maxilla is this part right here, underneath the upper teeth, which is called the palatine process. So all of this here, the roof of the mouth, is popularly known as the hard palate, and you can actually see right where that spring is. You can see a suture, and that separates the maxilla in front from the palatine bone in behind. So the hard palate, again, is made up of the maxilla and the palatine bone. You guys did a pretty good job on the quiz with that question, so I'm pretty confident you're going to do pretty well there. So, and we also have here the mandible. Now, the mandible is pretty unique in that it is the only movable bone in the skull. Obviously, the mandible moves up and down as we speak. I'm so sorry. And so this is a pretty unique bone among all the bones of the skull in that it moves. Now, there are a few things you need to know here. The mandibular condyle is the part right here that sticks into the temporal bone to form the temporomandibular joint. So some of you who have temporomandibular joint syndrome may have swelling here, may have inflammation that interferes with the movement of the joint. Maybe it snaps when you try to open and close your mouth, so it can be very painful. It can cause stiffness. It can cause you not to be able to open your jaw for extended periods of time. So we have the mandibular condyle there. Then the pointy part here is the coronoid process. And finally, we have the mental foramen. So that's a mental foramen. That's the other mental foramen. I like to remember these because those are the holes that I press on when I need to think. So if I'm deep in thought, I'm sort of making contact with my mental foramina here. So the only bone that we have not yet identified is the lacrimal bone. So this is going to be a little hard for me to show, but if you look right inside the eye socket, so sort of right there, you can see a divot right on the inside of the orbit. That is the lacrimal bone. The lacrimal bone houses your tear ducts. It houses your lacrimal glands, which produce tears. And so when you are crying with joy after you get such a good grade on this test, you'll know exactly where your lacrimal bones are because that's where your tears will come from. Yay. So I'm going to take a break. I'm going to blow my nose and I'm going to get another sip of water. And then we'll talk about the vertebrae. If you have any questions about the skull, hit me up in the chat box while I'm gone. I'll be back in about 1 minute. I almost forgot one thing. So, one of the most difficult things to master on this skull is the foramina. So, let's briefly talk about those. I'm going to grab a pen. Excuse my reach. So I can better point to these. So, this right here is the sort of innermost of the foramina. There's one here. There's another one over here. These are called the Foramen Lacerum, Lacerum. This right here is the Foramen Ovale, and you can see that nice oval shape there. That's the other one. The tiny little opening here, I'm going to get a little bit of a close-up here. That opening right there is the Foramen Spinosum. Then this one that is thoroughly colored in, thank you to whoever did that, might have been me, is the Carotid Canal, and that's really important because the carotid artery, which goes through that opening, supplies blood to the brain. Very, very important job. And then underneath there, you can see this opening here. That's the jugular foramen. And that's also really important because the jugular vein brings blood back down from the brain to the heart to get oxygen again. So both of these, the carotid canal and the jugular foramen, are really, really important openings because of the blood vessels that go through them. So that was a sort of quick review of the foramina. Again, hit me up if you have any questions. Seems like everybody's pretty content. And hopefully the other 60 or so students in my class get to see this at some point. So let's move on to the vertebrae. So I'm going to go ahead and start with the two special vertebrae. They're all special, don't get me wrong. But the two sort of special vertebrae that are so special that we call them by name. So this one here is the atlas. This is C1, the first cervical vertebra. So this articulates with the occipital condyles of the occipital bone and forms a physical connection between the skull and the vertebrae. So this one is what happens when you say yes. So when you nod your head, you're using the joint between the atlas, which you can see here has a very big opening, and it has those transverse foramina like all the cervical vertebrae do, and the occipital condyles like we talked about. So this, I'm going to look at it from the side here. That is the axis. This is C2. If we look at it from here, it looks it looks different because it's got this projection right here sticking up out of the top. That is called the dens or the odontoid process. So you can see it's still got those transverse foramina like all the cervical vertebrae do. It's got a spinous process sticking out of the back, and it forms a joint with the atlas. So you can see here, this is what it would look like from above. This would be the front of the body. This would be the back because the spinous process is sticking out the back. And so this is the sort of movement that would be possible there. So when you shake your head no, you're using the joint between the axis and the atlas. Okay. So you'll want to be able to tell those apart by name. So again, this is the atlas. This is the axis. Those are both examples of cervical vertebrae. Here's another one of the cervical vertebrae. This happens to be C3, so the one right underneath it. You can see here, it's relatively small. It's got relatively small transverse processes here, and it's got transverse foramina sticking out at the side. These are extra holes that accommodate spinal nerves that come out of the spinal cord. So we're going to compare this to a thoracic vertebra. This is T8. So you can see the transverse processes out to the side here. The transverse process in a thoracic vertebra is pretty knobby. It's pretty thick. And that's because each of the thoracic vertebrae connect with ribs on either side. So each of these transverse processes connects with a rib. 12 pairs of ribs means 12 thoracic vertebrae. We also have the spinous process, which sticks out and down below. And of course, we have the body here, the big rounded part. Then the superior articular process is here above the body, and the inferior articular process is right here. So generally speaking, the superior articular process of one vertebra connects with the inferior articular process of the one above it. Then we have on the sides, we have the pedicles. So right here and right here. And the angled part up here, as we go sort of bridging the gap between the transverse process and the spinous process, that is called the lamina. That's about all you need to know for a general vertebra. So this is a lumbar vertebra. We can see as we compare it to a thoracic, this is L2, so it's actually not far away from this. You can see that the lumbar vertebrae have a much bigger body, and their transverse processes and their spinous processes, you can see they're generally like shorter and stubbier compared to the rest of the vertebra. And these are definitely all irregular bones because they've got all sorts of funky shapes to them. So you can see from the side, these look pretty similar. And you can see the superior and inferior articular processes on these as well. Then now we know that we have a total of 26 vertebrae in an adult, 7 cervical, 12 thoracic, 5 lumbar vertebrae. Then the next 5 vertebrae, and you can see here, it's a little hard to see on this image, but you can sort of see where the 5 vertebrae fuse together. This is called the sacrum. So this is the back of the sacrum. And the reason you know that is because we have this structure here called the median sacral crest. The body of the sacrum is called the sacral promontory. And all of these openings, as you might predict, are called sacral foramina. If you throw out that word foramina for an opening, you've got a pretty good chance of being right, at least on this lab practical. So, and then of course we have the coccyx, which is 4 more fused vertebrae way at the base of the vertebral column. I'm not going to ask you to identify those. It's frankly too small and hard to find, so we're not going to worry about that one. One last bone. We have here the sternum. Sternum sits right in your chest. The clavicles connect here, and the ribs connect with cartilage to really the first 10 pairs of ribs connect with the sternum here, either directly or indirectly via cartilage. That's what all these clear parts are. Then we have 3 parts to the sternum. The part where the clavicle connects, this wider part here, is called the manubrium. The thinner part in the middle is called the body. And then, as it tapers to a point here, this is called the xiphoid process. It's named because it resembles a sword, something that Mr. Muncie taught me a while back. So that is about all of the stuff that I have. Let me just double check that I haven't forgotten anything on the... No, I think I've got it pretty well covered. So if there are any questions, we just hit the 38-minute mark here. So if there are any questions, I'll give you about 2 more minutes to chime in on the side. I'm also going to double check my email to make sure nobody else had any questions. But if you're feeling good about things, then we can probably call it a night. Because as you can hear, I probably could stand to rest my voice. Okay, so we've got a question from Jojo about the pedicle and the lamina. I think the best way to show this, actually, I'm gonna show this on a lumbar vertebra here. So we're looking at the top of this lumbar vertebra. So the pedicles and the lamina sort of form the ring that is the vertebral foramen. The vertebral foramen is the opening here that accommodates the spinal cord. So the pedicles are this tiny little stretch along the side. So if I point to it with my pen, it's going to be this part right here, right along the side. Now, the lamina is going to be this part right here. So you can kind of see how it bridges the gap between the transverse process over here and the spinous process up top. So again, this right here, this angled part that sort of comes up in a V, that is the lamina. So I hope that helps. Frankly, I'm much more concerned that you understand these processes, that you know that these are the transverse processes, and that in the thoracic vertebrae in particular, they connect with ribs, and that this is the spinous process that sticks out the back. Hope that helps. So now, I'll give you about another 30 more seconds to ask some questions, and otherwise I'll go ahead and rest my voice for tomorrow. Luckily, there's not a lot of talking I have to do tomorrow. So now I think we've kind of laid everything out. You know the bones you have to know. There's not a lot of high level stuff here. You just kind of have to know where stuff is and what parts each bone has. So we've kind of put everything out there. You've got this. You've got a ton of resources on the internet. JoJo sent us a great link. And aside from that, the rest is up to you. So put in the work between now and tomorrow or Tuesday. If you need me for anything, I'm going to be in a little early tomorrow running some stuff off. So come hit me up. We'll hang out. You can ask any questions you might have. And I'm going to go hang out with my wife and get ready for Monday. So I hope that you had a productive experience here. And I'm going to go rest my voice. So see you tomorrow. Good luck studying.